Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about normal and pathological tissues, which is part of the IBMS Specialist Portfolio in Cellular Pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, supporting evidence ideas and some helpful tips that can make your portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the subsection. Knowledge requirement is what it is expected of you to know and understand to demonstrate your knowledge is at the specialist level. Think about what knowledge you had as a Band 5 BMS. How would that differ to the knowledge as a Band 6 BMS? That specialist level of knowledge would allow you to troubleshoot, problem solve, verify, validate, help others and maintain high-quality service. Let's have a look at the first knowledge requirement, which is for you to know about the biology of normal and abnormal growth. What is normal and abnormal cell growth? How do they differ? What can abnormal cell growth lead to? Consider cell cycle, growth regulation, apoptosis, density inhibition, appearance, function, adhesion, nutrient demand, mutation, uncontrolled proliferation, immortalization, benign growth, dysplasia, metaplasia, neoplasia, invasion. The second knowledge requirement is for you to know the macroscopic and microscopic features of normal tissue for the main organ systems. What are the macroscopic and microscopic features of normal tissue from main organ systems? Consider microscopic features like ordered patterns, specific structures, parenchyma, stroma, layers present in tissues, functional units of major organs, cell types present in tissues and so on. Consider macroscopic features like shape, size, color of organs, their anatomy and function, their texture and so on. The third knowledge requirement is for you to know about the use of algorithms to aid the diagnosis of malignant diseases. What algorithms can be used to aid diagnosis of malignant diseases? Consider medical imaging, risk stratification scoring, diagnostic checklists, grading and staging, diagnostic test bundles, tumor markers, guidelines like RC-Path or NICE, gross examination, microscopic examination, AI algorithms, molecular analysis, dual reporting. The fourth knowledge requirement is for you to know the reasons for tissue preparation for microscopy examination. Why is histological tissue prepared for microscopic examination? Consider preservation to prevent decay, autolysis and putrefaction, provide support and tissue hardening to enable sectioning, staining to visualize tissue architecture, dehydration and clearing to make the tissue transparent and achieve permanent preparation. Also consider tissue preparation to enable diagnosis of disease, guiding treatment, staging and grading neoplasms, prognosis or screening. The fifth knowledge requirement is for you to know the value of accurate specimen site identification for the reporting of specimens, e.g. Barrett's esophagus. Why is it important to select the accurate specimen site from the reporting point of view? What could happen if an inaccurate specimen site was sampled? Consider accurate diagnosis, patient safety, effective surveillance, appropriate treatment plan, mitigation of diagnostic error, relevance in complex cases. The sixth knowledge requirement is for you to know the classification of diseases using pathology nomenclature. What are the key components of pathology nomenclature and classification? What histological terminology can be used to classify diseases? Consider standardized systems, behavior code like benign, uncertain, in or malignant, WHO and international classification, TNM staging, grading, topography, morphology, neoplasm, inflammation, dysplasia or metaplasia. Can you give examples of systems and their uses? Consider SNOMED-CT systematized nomenclature of medicine for clinical terms, ICD-0 international classification of diseases for oncology or ICD general. The seventh knowledge requirement is for you to know the nuclear and cytoplasmic changes of reversible cell injury. What are the nuclear and cytoplasmic changes of reversible cell injury? Consider chromatin clumping, hydropic changes, blebbing, loss of microvilli, steatosis, eosinophilia, organelle changes like dilation of endoplasmic reticulum, detachment of ribosomes or mitochondrial swelling, plasma membrane alterations, loss of intercellular attachments, minimal fragmentation. The eighth knowledge requirement is for you to know the most important causes of cell injury. What are the most important causes of cell injury? Consider hypoxia, ischemia, infectious agents, physical damage like trauma, temperature injury, radiation, atmospheric pressure or electric shock, pathogens like viruses, bacteria, or fungi, chemical damage via toxins, pollutants, or drugs. The ninth knowledge requirement is for you to know the metaplastic process in a variety of organs. What is metaplasia? What can cause metaplasia? Consider the key aspects of the metaplastic process that starts with trigger like chronic irritation, inflammation, or injury, mechanism like genetic reprogramming, reversing of the process if the irritant is removed, tissue can return to its original state, precancerous potential as metaplasia is known precursor to dysplasia and neoplasia, adaptive response of the tissue, defense mechanism, change from fragile to robust tissue type. Also consider tissue-specific examples like Barrett's esophagus, squamous metaplasia, gastric intestinal metaplasia, myeloid metaplasia. The 10th knowledge requirement is for you to know about the atrophy, and can give examples of this form of adaptation. What is atrophy? What is the difference between physiological and pathological atrophy? Can you give examples for each? Consider cellular adaptation, cell shrinkage, reversible process, survival response to unfavorable environment, reduced functional demand, reduced oxygen consumption, reduced protein synthesis, disuse, lack of stimuli, hormonal atrophy following pregnancy, atrophy due to nerve damage, aging or ischemia, protein imbalance or pressure. Also consider specific examples like muscle atrophy due to disuse, uterus or mammary glands atrophy post-pregnancy, thymus and skin atrophy due to aging, female reproductive organs after menopause, brain senile atrophy. The 11th knowledge requirement is for you to know the causes of hypertrophy and hyperplasia, and can give appropriate examples of each. What is hypertrophy and hyperplasia? What can cause them? Can you give examples for each? Consider physiological and pathological hypertrophy and hyperplasia. Causes increased hormonal stimulation, like in uterus during pregnancy, breast during puberty, increased functional demand, like in skeletal muscle due to exercise, compensatory response due to regeneration, excessive stimulation by growth factors, response to injury. Can you give examples of hypertrophy and hyperplasia? Consider cardiac hypertrophy due to hypertension, skeletal muscle growth due to exercise, compensatory renal hypertrophy due to having only one kidney, liver regeneration following partial resection, uterus during pregnancy, breast tissue during puberty. The 12th knowledge requirement is for you to know the various forms of necrosis, and can give appropriate examples of each. What is necrosis? What can cause necrosis? Consider toxins, infection, ischemia. What forms of necrosis do you know? Consider liquefactive, in cerebral infarction, abscess formation, caseous, in TB or some fungal infections, coagulative, in myocardial, renal or splenic infarction, fibrinoid, in vasculitis, fat, in acute pancreatitis or traumatic injury to fatty tissue, gangrenous, in wet and dry gangrene, gummatus and syphilis, hemorrhagic due to blockage, acute tubular due to death of kidney tubule cells, wound healing necrosis like eschar and SLU. The 13th knowledge requirement is for you to know about the programmed cell death, apoptosis. What is apoptosis? What are the key steps of apoptosis? Consider natural healthy controlled elimination, harm prevention, maintaining tissue health, clean self-destructive process, key steps like cell shrinkage, skeleton collapse, DNA fragmentation, formation of apoptotic bodies, phagocytosis for clean disposal. What are the reasons behind apoptosis? Consider development, maintaining tissue homeostasis, immune response, or cancer prevention. What can cause apoptosis? Consider damage, radiation, infection, cell detachment from extracellular matrix, withdrawal of growth factors. How is apoptosis controlled? Consider genetic and environmental signals, activation or inhibition of caspase family of proteases, deciding survival or destruction. The 14th knowledge requirement is for you to know about the autophagy and its role in homeostasis and disease. What is autophagy? What role does autophagy play in homeostasis? Consider clearing damaged organelles, recycling damaged organelles to provide building blocks for new cellular components, stress response to maintain energy balance and cellular survival, development by regulating cell differentiation. What role does autophagy play in disease? Consider protein removal and its impairment leading to Alzheimer's or Parkinson's disease, tumor initiation suppression and its impairment leading to cell survival and tumor formation, pathogen elimination, supporting innate and adaptive immune responses, dysfunction in autophagy and metabolic or cardiovascular disease. Competence requirement is basically a combination of knowledge, skills, and experience one needs to perform a job to a satisfactory standard and level. Your chosen evidence should demonstrate these competence requirements. The following competence requirements need to be met for this section. Let's explore the first competence requirement, which is for you to recognize macroscopic and microscopic differences in normal and abnormal tissues from all major organ types. What are the macroscopic and microscopic differences in normal and abnormal tissues for major organs? Consider shape, size, color, texture, anatomy, function of organs, macroscopic abnormalities, erythema, edema, pus, necrosis or fibrosis. Also consider microscopic differences like cell size, shape and type, mitosis, differentiation and arrangement, nuclear appearance, stroma, parenchyma, and blood supply, layers, ordered patterns or dissociation, pleomorphism, hyperchromasia, anaplasia or invasion. Also consider your training and competence in this area. The second competence requirement is for you to recognize microscopically different types of epithelia and their location in the body. What types of epithelia can be found in the body? How do they differ microscopically? Where would you find each type? Consider simple squamous, cuboidal, columnar epithelium, stratified squamous, cuboidal and columnar epithelium, pseudostratified and transitional epithelium and their locations. How would they look like on H&E stained section? Consider number of layers, cell shape, specialization. The third competence requirement is for you to recognize the following conditions: hypertrophy, hyperplasia, parakeratosis, atrophy, necrosis, metaplasia, apoptosis, autophagy. What are these conditions? How would you recognize them on H&E stained section? Consider microscopic appearance of each, key identifiable features, any cellular, morphological or architectural changes from normal features, any staining patterns associated with these conditions, special stains that could be used to highlight them. The fourth competence requirement is for you to discuss the role of supplementary tests in the evaluation of pathological tissues. What are supplementary tests and when would they be used? What is their role in the evaluation of pathological tissues? Consider refined diagnosis, tumor typing and classification, prognostic assessment, predictive testing, identification of infections. What supplementary tests can be used? Consider IHC, specials, molecular tests for confirmation of diagnosis, ISH-EM, if. Each section also contains reflective statement which is asking you, the candidate, to summarize your role in the laboratory in the context with each section. When you complete all the subsections within this section, you will be required to write a reflective statement. You also need to write a personal reflection on your training and why you chose your evidence. To prepare for that, write a smaller reflective statement for each subsection. What is your role in context of this subsection within the laboratory? What does your evidence demonstrate? Also write a smaller justification as to why you chose your evidence for this subsection. Also write what was your training like when it comes to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier at the end of the section. Each subsection also has evidence of achievement. This is a part where your training officer signs you off as competent and fit to practice as a BMS at the specialist level. Training officer will confirm that you can work in accordance with local SOPs relevant to this section. They will also confirm that you have answered questions set by them to test knowledge and skills relevant to this section. And they will confirm that your chosen evidence demonstrates your competence relevant to this section. You will need to be signed off as competent by internal assessor for this section. This can be your training officer, senior BMS overseeing this section, or a training lead. Questions should be set by the training officer. They need to be based around the knowledge requirements relevant for each subsection. They should allow the candidate to demonstrate their understanding in each subsection. The questions should be specific and relevant to the candidate's in-house practice. They should also allow the candidate to demonstrate their specialist knowledge. If you would like to see specific example questions, please have a look at the video for trainers. Link will be included in the video description. These are some ideas for supportive evidence you will have to submit to demonstrate your competence in this area. Some more ideas for supportive evidence to demonstrate your competence in this area. I would also like to share with you some helpful tips that can make your portfolio look really good. Try to present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs, or even videos, if you can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Try to make it a little bit more interesting to the reader, which will be your training officer and eventually the assessor. Try to put yourself in their shoes. How would you like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture is worth 1,000 words. I will make a video. I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also try to use various types of evidence, not just one type, like case studies for each subsection. You could use experiments, case studies, annotated results, annotated photographs of you performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation and verification as, comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Try to bring in your personality. Think about the ways you like to learn best. If you like experimenting, perform experiments. Like troubleshooting, perform troubleshooting. Choose something that demonstrates your understanding, knowledge, skills, and how you apply this in your practice. And one more thing, keep the competence requirements in mind when you selecting your evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirement for this section. And I hope you also have a better idea what evidence you can choose to demonstrate your competence. And my final take-home message? Keep those requirements in mind when answering questions and selecting your evidence. Bye for now.